diseases are the leading cause of disability and death worldwide. Many factors like smoking, unhealthy diets, and sedentary lifestyles are modifiable, which means that effective and inexpensive actions can be taken to promote health and prevent the onset of chronic diseases. Workplaces are important settings to introduce such actions, to create environments that support health and encourage healthy habits. In 2016, the European Joint Action CHRODIS selected the Lombardy Workplace Health Promotion Network as a good practice that positively reduced a number of risk factors. Based on this model, in 2019, the Andalusian Regional Ministry of Health began the pilot implementation of a workplace health promotion intervention in 2 organizations in Granada. The intervention consisted of 5 essential steps. 1. Situation analyses and creation of a steering group. 2. Health and safety regulatory compliance. 3. Pre- and post-implementation analyses. 4. Health promotion actions. And 5. Certification system for health promoting organizations. At the initial stage, introductory health promoting sessions were held in each organization for all employees. Then, practical workshops and health promotion actions were offered to the workforce, free of charge and on a voluntary basis. After the first 9 months of intervention, results are promising. Data indicate an increase in physical activity among the participants, as well as an increase in the intake of fruit and vegetables and a reduction in the consumption of sugary products. At present, Andalusia carries on the piloting to reach Lombardy's 3-year intervention model. Both regions continue their collaboration on this transfer, which will turn into an improved Andalusian workplace health promotion program that is initially expected to reach more than 200 organizations and 7,000 employees in Andalusia.
I am delighted to visit the schools in Turin. The work that I've seen is very impressive. I visited 2 schools and I can see that active breaks are being introduced into Italian schools, and that's something very new. I think we had the pleasure of having a visit from a number of Italian teachers and principals, and Susanna and Patricia went back to their schools to introduce the active flag, and their enthusiasm meant that they brought other teachers on board, and other teachers who knew nothing about the active flag trusted in Susanna and Patricia, and they're making very real changes in classrooms. So in the classes that are involved in active flag, their day is much more energized, which is a really important part of the active flag. And I think the feedback from teachers is that because there's more energy throughout the day, the concentration and focus is much improved. And again, that's similar to what Irish teachers find. After wake up, shake up, how do you feel?
Good.
Good?
More better.
Tired?
No.
Alert?
Yes.
Fish?
Yes.
2018–2020 metais Klaipėdos rajone į aktyvių mokyklų vėliavos intervenciją prisijungė 3 mokyklos. Slengių daugiafunkcis centras, Šiuparių daugiafunkcis centras ir Ievos Labutytės Likių pagrindinė mokykla. Viso projekte dalyvavo 300 mokinių, orientavomės mes į pradinių klasių mokinius. Mūsų tikslas buvo skatinti vaikų fizinį aktyvumą, kuriant fiziškai aktyvias bendruomenes, organizuojant įvairius renginius, įvairius elementus, fizinio aktyvumo elementų įtraukimą į pamokas, į pertraukas ir mokinių laisvalaikį.
Ši intervencija buvo diegiama 2 Klaipėdos miesto mokyklose, Gilijos pradinėje mokykloje ir Sendvario progimnazijoje. Buvo perimti iš airių intervencijos keletas komponentų, tai bėgiojimo iššūkiai, vaikai bėgo iki pasirinktos Europos sostinės, tai yra visų mokinių nubėgti ratai buvo sumuojami ir verčiami į kilometrus. Taip pat praėjusiais metais, gegužės mėnesį, abiejose mokyklose buvo suorganizuota aktyvių mokyklų savaitė. Šios savaitės metu buvo vykdomi įvairūs renginiai, kurie skatino vaikus būti fiziškai aktyvius. Buvo komandinių žaidimų, estafečių, taip pat vyko daug aktyvių pertraukų. Tikimės, kad ateityje išbandyti šios intervencijos komponentus ryšis ir kitos Lietuvos mokyklos. Nes skatinti vaikus būti aktyviais, tai yra mūsų visų ateitis ir sveikas vaikas yra didžiulė vertybė.
Það skrýtna er að ég hafði alltaf fordóma gagnvart svona tækjasölum. Svo alltaf, þetta er ekki fyrir mig. En akkurat núna sé ég það að það var mesta fyrra og dauðsí eftir þessum fordómum og hefði gjarnan viljað byrja miklu fyrir í svona tækjum. Þetta prógram hjá Janusi er bara snilld út í gegn. Því að allt er þetta sniðið að hverjum og einu.
Allir þáttakendur sem koma með þjálfun til okkar, við byrjum á því að mæla það allir í upphafi. Aðaláherslan liggur í þjálfunarþættinum hjá okkur. Hún er skiptuð í tvennt, það er annars vegar þolþjálfun og svo er það styrktarþjálfunin. Annar þáttur hjá okkur, það er fræðslan og þar erum við í samstarfi við fagaðila á sínum sviðum.
Það sem gerist þegar við eldumst meðal annars er að vöðvamassin rýrnar til muna og því er mjög mikilvægt að stunda þungaberandi þjálfun eða styrktarþjálfun.
Ég var í bifsi í 6 vikur. Löppin á manni rýrnaði við þennan tíma, en svo þegar ég byrja aftur og þá við þessar æfingar og þá lagaðist þetta mjög fljótt.
Ég finn að ég er að halda mínum styrk og þoli sem ég hef, sem ég finnst mjög gott.
Ég fann að ég verið að styrkast. Núna hef ég þörf fyrir þetta.
En ég finn eftir þetta, eftir að maður fór í svona kerfisbundna hreyfingu, þar sem þetta allt svona mælt og lagt fyrir maður, þá einhvern veginn svona finnur maður svona heildstæðari áhrif á allan líkamann. Ég hefði persónulega viljað byrja miklu fyrr. Þess vegna bara 50-60 sko, vera í einhverju svona markvissu.
Og annað sem að mér hefur alltaf fundist vera stórkostlegast við þetta og það eru þessar mælingar. Að geta fundið út alveg handastyrk, fótastyrk og bara hvernig líkaminn á sig komið. Ég er búin að vera í 3 ár og það er þvílíkur munur.
Það verður í rauninni ekki mikið betra og ánægilegur en að sjá einstaklingana vaxa og dafna þrátt fyrir hækkandi aldur. Þetta það sem við erum svona fyrst og síðast að stefna að. Það er að auka ekki eingöngu afkastagetu, hreyfifærni, styrk og þol, heldur að auka almenn lífsgæði, heilsu og ekki síður félagslega nánd þátttakenda.
The Health Promotion Program of Janus Health Promotion, Multimodal Training Intervention and Approach to Successful Aging, was successfully implemented in Klaipėda, Lithuania and Otebo, Spain through the CHRODIS Plus program. At the start of the CHRODIS Plus program, the teams from Lithuania and Spain visited the headquarters of Janus Health Promotion in Iceland. The teams spent 5 days in Iceland watching and learning from the training and measurement process. During and after the visit, Janus Health Promotion shared material and instructions with the teams so that they could start preparing and implementing the intervention in their countries. The Janus Health Promotion team visited both countries once the training had started to observe, assist and ensure the quality of the intervention. All 3 teams from Lithuania, Spain and Iceland then participated together in the CHRODIS Plus conference in Budapest, Hungary, to showcase their progress and results so far. One of the key elements of the multimodal training intervention is the fact that we track around 30 different variables by doing extensive measurements every 6 months. These measurements grasp the physical attributes and capacity of the participants, as well as their mental health and quality of life. After having ran the intervention with the first group in Iceland for the full 2-year period, we saw that all 30 variables had developed positively, and most of them very positively. It is also important to note that all measurements were statistically significant. It was therefore a great pleasure to see that we saw similar results in both Lithuania and Spain after having ran the intervention in both countries for 1 year. This indicates that the intervention is well suited to be implemented in different countries with good results, and these results could serve a key role in battling and preventing chronic disease. Thank you.
My name is Gia and I'm Program Manager for the Health Promoting Community Program. On behalf of the Directorates of Health team, here is a short introduction on how the Dutch JOG program and the National Policy Dialogue have contributed to the development of our program in Iceland. The Health Promoting Community Program is a result of a sort of ongoing fusion cooking, based on previous work in Iceland, Europe and the rest of the world. And with the European Commission support, this time we are learning from JOG. Here is more about JOG from Liedeke.
My name is Liedeke Middelbeek. I'm a senior advisor at JOG in the Netherlands. I'm also coordinating our international activities and I've been working with the Directorate of Health in Iceland on the CHRODIS project. JOG is a national foundation in the Netherlands, and at JOG we focus at reshaping the environment of our youth using a community-based approach. We are currently working in 146 municipalities in the Netherlands, and together with those municipalities and our partners from the public, private as well as the academic sector, we aim to promote a healthy lifestyle and well-being for our children with a special focus on a healthy weight. Over the years, we've developed an extensive support system to help our municipalities with the implementation of the JOC approach. And currently we see a decrease of the percentage of overweight among children in 32 municipalities, and we reach over 1 million children with our programs and activities.
Health Promoting Community has been under development for some years. The main aim is to support communities to work in a systematic way to create environments and conditions that promote healthy lifestyle, health well-being of all inhabitants. Via agreements between DOHI and 34 municipalities, currently 93.5% of the population live in a health promoting community. The program is an umbrella for comprehensive data-driven settings approach across the lifespan in schools, in workplaces, and for the health promotion of older adults. This implementation addressed two main challenges. Firstly, the need to improve the program structure at national level. The CHRODIS Plus policy dialogue was utilized to frame the program in line with the Sustainable Development Goals and other governmental issues via the translation of the WHO SDG infographic, adaptation of the social determinants of health rainbow, numerous meetings and other efforts. The result was the formation of the high-level steering group and the consultation platform for the health promoting community and the Sustainable Development Goals, involving the Prime Minister's office and other ministries, various agencies and other stakeholders. This was an important step to address the second main challenge, the need to provide further support to local coordinators and steering groups. Various JOC material was translated and adapted, contributing to the development of checklists and other material available on the web-based work area heilsueflandi.is for municipalities. And here you can see part of our local coordinators. The learning points from this implementation include support from the good practice owner is critical. It's helpful to frame the work in line with governmental priorities and root in existing work if possible. Establishing structure takes time, but it's worth the effort. Practical and flexible approach is needed, and European projects like CHRODIS Plus help good things happen, and not least important, document it. Thank you.